Don't pay that bill. You might not owe that. In previous videos, we explain why doctors' charges don't indicate what they get paid or what you owe for a medical service. See our video, My Doctor Charged What, for more detail. In this video, we examine an actual patient bill for anesthesiology services. This example was sent to us by a patient in the Southeast. After her surgery, a doctor sent this bill to the patient and she couldn't understand why she was being charged and asked to pay so much for anesthesiology services. If you watched our video, The Medical Billing Mystery Solved, we discuss why there are multiple bills from different entities when a surgery is performed in an ambulatory surgery center, or ASC, a surgery center outside of a hospital.
You might receive a bill for the surgeon, the doctor, a bill for the surgery center, a facility fee, a fee for equipment, and a fee for the anesthesiologist. This patient's bill came from the anesthesiologist for a surgery performed at an ASC. Aside from the fact that the charge was enormous at nearly $3,500 for an hour-long surgery, doctors never get paid what they charge. So while the clinician continued to bill the patient nearly $3,500 multiple times, we noticed that the anesthesiologist had not yet billed the patient's insurance company. In other words, the doctor billed the patient directly and never submitted a claim to the insurance company. If the doctor was in network with the patient's insurance, the charges would be reduced to the allowable. For instance, the allowable, what the doctor agrees to be paid for his services, might be $400 or so. It's also worth noting that when doctors participate with insurance companies, they assume the duty of submitting claims to the insurance company on behalf of the patient. This should occur before the doctor bills the patient.
In this case, the doctor never submitted the claim to the insurance company, and yet his practice still billed the patient for the $3,500. In the contract between an insurance company and a doctor, there normally is a clause called a timely filing clause. This indicates the length of time a doctor has from the date of service was performed to when he can file a claim with the insurance company. For instance, some insurance companies have a 6-month timely filing deadline. This means that if a patient is seen by a doctor on January 1st, the doctor might only have until June 30th to file their claim with the insurance company. If the clinic does not file timely, the patient generally is not obligated to pay for the service. So in this case, 15 months passed as the doctor's office failed to submit the claim to the insurance company. So the patient did not owe anything due to a lack of timely filing by the anesthesiologist's office.
Now, CUBE does not suggest holding out on money that patients owe for services. Instead, we are all making sure doctors follow the guidelines in their insurance contracts and that people don't overpay for a service. Imagine if you paid $3,500 for this service, but the doctor was owed only $400. With our customer in the Southeast, the doctor did not file timely and the medical practice lost out on the revenue. For instance, Medicare allows 12 months for timely filing of claims from the date of service. So, if you are a Medicare patient and you see a doctor on January 1st, your doctor has until December 31st of that year to file a claim, or it becomes uncollectible. This is a very simplistic example, but as with our other videos, paints a directionally accurate picture of care delivery across the United States. Remember, CUBE's videos are not meant to answer all questions precisely. There are so many moving parts in the delivery of care throughout the country. Just remember, some nuance exists geographically. Healthcare really is local. If you have an idea you'd like to address, please subscribe, like, share, and if you have any questions, email them confidentially to questions@cube.org. Stay tuned for our next educational video.